Okay, we're going to talk about medications now. We've went through all of them. You have your doses, you have your medication study guide. We're going to talk about these here. We'll start with the aspirin, and I want to start with the albuterol, right? So a meter dose inhaler, this will come oftentimes like this. This is a pro-air albuterol sulfate, okay? They come in a variety of different things now, but they all have the general thing of a canister, okay, a little mouthpiece. A lot of them now have counters on them, not really applicable to you. Things that you care about are going to be, expiration date right there, that it is actually pro-air albuterol in there. You're not going to find a name on this. You're not going to find anything else like that. You want the audible click, right? So that's seated in there. You can pull this out. You can warm it up if it's cold outside. You can give it a good shake. Depress that, and then give it a good squeeze to make sure that we are good to go. And we'll do that before then helping the patient with it. Okay. So that is your albuterol sulfate. 1 to 2 puffs will normally do it for a patient. Again, checking for prior doses and different things like that. Next is going to be your aspirin. We're giving baby aspirin, 81 milligram tablets, chewable. We don't want them to swallow this. We want them to chew this, let it dissolve in the mucosal membranes of the mouth. Making sure we're checking expiration dates and things like that on the bottles. These are, pretty standard generic tablets. We'd give them 4 of them, right? 3, 4. 4 baby chewable aspirin, 81 milligram tablets, 324 milligrams of aspirin, unless contraindicated, right? That would go along with our nitro, which will come in that brown opaque bottle. It is light sensitive. When we're giving out nitro, we want to make sure we do it in the cap. We don't want to touch it. We want to make sure that we check the tablets, make sure that they're intact, they're not disintegrated, or they're not broken up into pieces. And we would give that to them under the tongue, let it dissolve, okay? That's going to be 0.3 milligrams to 0.4 milligrams, depending on whether it's a spray or a tablet or whatnot, okay? Once again, we'll always give those hand in hand. That's going to be our mono protocol, and we're going to follow that unless one of them is contraindicated, okay? Next up, we'll do our glucose. So our glucose comes in a variety of different things, right? You're going to see the glucose 15 more often in your rigs. You'll see this more and more. You're looking for the expiration date, which is going to be on this crimped end here, 15 grams. It's lemon flavored, but that doesn't mean anything. We can just tear this open, put it on a tongue depressor or popsicle stick, or just hand this to them and have them squeeze small amounts into their mouth, letting it dissolve, right? The other option here would be, your Dex 4 fast-acting glucose. Once again, 15 grams is in here, making sure it's not expired. Our expiration date, checking that, making sure we're good there. And then once again, putting it on a popsicle stick or doing something so that they don't just put this in their mouth, squeeze the whole thing in their mouth and swallow it. We don't want that. This one's fruit punch flavored, and it may or may not taste like fruit punch, who knows? But those are your glucose. Once again, this is for altered mental status of a hypoglycemic patient. And the only thing we really care about is that they can maintain their own airway. Next up, we're going to be our EpiPens. Okay, so we've got a few different kinds here. You've got your generic one, which is, older. You don't see this one as often. You see these two more frequently. The gray is your safety. The black is your tip end. So don't put your fingers over the tip. Don't ever play with that end. The nice thing about these is that they do have your 3-step instructions on them. You'll have your expiration dates, and all the different things on there. Okay, so following the directions, you're gonna pull the cap. You're gonna check their pockets, make sure there's nothing in them. You're gonna hold it in your hand nice and firm. Okay, and then you're going to depress into someone's thigh, not the arm, but the thigh, till it clicks, and hold for 10 seconds. Okay. At which point you would dispose of into a sharps container or whatever is appropriate. Don't ever recap it. Don't ever do that. But that's that one. The next one is going to be your EpiPen. This is your brand name one. Once again, they'll have their directions on them. They will also have a little window on them, the real ones, to see the fluid inside, make sure it's not milky or whatnot. It's clear, it's not cloudy, and doesn't have floaties in it. The blue is your safety, the orange is your tip. Okay, so hold it, pull your blue safety off, and the same thing here. Patient's thigh, not their forearm, but for this purpose, you're going to stab it into their leg, hold for 10 seconds, at which point you're going to release, and it will have an orange shroud that comes out, protects the needle, but we're still going to want to dispose of that into a sharps container as well, just so that we don't have an accidental exposure with that. Okay. With these as well, they also have the dosing on them. So, 0.3 being adult or 0.15 being pediatric. And then for the EpiPen ones, pediatrics are green and adults are yellow. This is an ABQ. This is a newer one you're seeing out there. It's been around for a while, but it's still newer than the rest of the other two. Adults are red. This is a 0.3 milligram auto injector. And then the pediatrics are blue. You will pull that out. If having an allergic emergency, pull off the red safety, and at which point you'll do the same thing, right? Here's a trainer that we have. So pull that off, pull the red safety off, and at that point you're going to depress. Okay, the nice thing about these is they do have speakers, they walk through it, watching for expiration dates and things like that as well with these. Okay, the same thing goes with this and the albuterol. On the actual pen itself, we're not going to find a name or a patient on it. So if the patient has it, we're just kind of taking them for the word on it. But this is something to look out for, especially with the expiration date, whatever. Moving on. Lastly, we have the Narcan. This isn't Narcan itself, but we're going to pretend it is. It's the same methodology. Okay, they're going to come in a kit like this. This will come separately, but we'll put them together. That is a mucosal atomizer device. Okay, they're going to go ahead, remove that cap. This screws on. Okay, take that off. Put your mat on. That'll go within the membrane. Okay, what the mat does is it takes it from being a squirt to a mist. Okay, allowing it to absorb more readily inside the nasal passages. We'll measure this out. These come in 2 milligram vials. So you'll put your finger where the 1 milligram is, you'll inject to the finger, and then you'll push the rest in the other nair. Okay. This will also go in a sharps container once we're done, just because it does have needles in it. And there is a potential of exposure there for sharp objects.